Very good afternoon to you all. My study is on ocular morbidity in acid-burn patients in a tertiary care hospital. Coming to the introduction, chemical injuries of the eye may produce extensive damage to ocular surface, conjunctiva, corneal epithelium, stroma, sclera, eyelids, resulting in permanent unilateral or bilateral visual impairment. Pathophysiological events that which may influence the final visual outcome and which are amenable to therapeutic modulation include ocular surface injuries and repair, stromal injury repair, and ulceration. Coming to the materials and methods, it is a prospective study of acid-burn patients who presented to AIO between August 17 to January 18 of 2018, followed up for till 3 months. They were subjected to slit lamp evaluation, fluorescence staining, TBUT, fundoscopic examination, IOP measurement, and gonioscopic evaluation. The patients with history of diabetes mellitus and hypertension, pseudophakia, were excluded from the study. Among the 29 patients with acid-burn injury in their eyes, 22 patients were victims of accidental acid burn while working in an acid factory. 4 suffered acid burn during household work, and the rest 3 are homicidal victims within age 18 to 30 years. Among the 26 patients, the 20 were males and the 6 were females. 44 eyes of 29 patients with acid burn were assessed using Roper Hall classification. At the time of presentation, visual acuity was less than 6/16 in 5 eyes, and in between 6 to 6/18 it was 20 eyes, and 6/12 to 6/9 it was 18 eyes. On examination, limbal ischemia was found in 70% of patients, corneal haze in 58%, stromal haze in 30% patients, and corneal opacity was found in 10% eyes. Grading of ocular burns were done according to Roper Hall classification. The eyes which presented with grade 1 injuries were 20 eyes, accounting for 45.5%, grade 2 with 12 eyes, 27.2%, and grade 3 with 7 eyes, 15.9%, and grade 4, the 5 eyes, accounting for 1.4% of the total patients. It was shown that during follow-up of visual acuity improved in 16 eyes, corneal opacity was found in 13 eyes, and symblepharon occurred in 6 eyes. The 4 eyes were referred for keratoplasty to the Hart Center, and VA remains still less than 6/16 in 5 eyes. Coming to the discussion, the sequelae of ocular burn can be severe and particularly challenging to manage. So immediately following acid injury, it is important to estimate and clinically grade the severity of limbal stem cells injury by assessing the limbal cell ischemia. Early vigorous irrigation with balanced salt solution or with normal saline is critical in limiting the duration of chemical contact with the eye. Immediate therapy is indicated towards prompt irrigation and removal of any reservoir of acid contact with the eye. The acid-burn patients who presented immediately after the incident and those who had thorough irrigation of their eyes prior to the coming to the hospital has had good visual prognosis and less ocular morbidity as compared to those who presented late. It was also found that those patients who were referred with complications had poor visual outcome. My study was compared with another study which was carried out by Dr. Subudhi et al. In southern belt of Odisha. They also found those patients who had presented late with complications. They landed in grade 4, just near to my study. They account for the 12.5%. Thank you.